But this is not only supports physical recovery, but also lowers the risk of certain complications after birth. Breastfeeding is also cost-productive and convenient, which indirectly supports maternal health. Since it is always available, sterile, and nutritionally complete, mothers avoid the stress and financial burden of formula feeding. This ease reduces anxiety, helps mothers focus on recovery, and creates a healthier environment for both mom and baby. Altogether, breastfeeding is not just a gift for the baby, but also a natural medicine for mothers. From lowering cancer risks to protecting against heart disease, supporting bone health, improving mental well-being, and helping with recovery, its benefits are far-reaching. Choosing to breastfeed gives mothers a lifetime of health advantages, making it one of the most important decisions for both their own future and their child.
Like, seriously, it's made just for them and changes as the baby grows. How cool is that? Also, I didn't realize how breastfeeding helps build this super strong bond between the mom and the baby. When they're close like that, it makes the baby feel safe and loved, and it's great for their emotional development. Plus, it helps the mom too. It can lower her stress and even help prevent postpartum depression. I love how something so natural can be so comforting for both the baby and the mom. And get this, there are health benefits for the mom as well.
If a mother has a genetic predisposition to diabetes, heart disease, or cancer, breastfeeding can significantly lower her risk. It acts as a natural defense mechanism, giving women more control over their long-term health. The emotional connection between mother and child is also a health benefit in itself. Breastfeeding creates a deep bond that improves emotional well-being for both. This bond helps reduce maternal stress levels and creates a sense of fulfillment that supports overall mental stability. It also has long-term effects on a child's emotional and psychological development. Breastfeeding is also beneficial for metabolism. By helping regulate blood sugar levels and improving insulin sensitivity, it lowers the risk of type 2 diabetes. This is especially important for women who experience gestational diabetes during pregnancy, as breastfeeding helps reduce their chances of developing permanent diabetes. For women recovering from childbirth, breastfeeding plays a role in faster healing. It encourages the uterus to contract, reducing postpartum bleeding and helping the body return to its pre-pregnancy state more quickly. This not only supports physical recovery, but also lowers the risk of certain complications after birth. However, it's not clear how far physical recovery is equivalent to mental recovery, since some colonists are more likely to report seeing loss of birth weight. But this is not only supports physical recovery, but also lowers the risk of certain complications after birth. Breastfeeding is also cost-productive and convenient, which indirectly supports maternal health. Since it is always available, sterile, and nutritionally complete, mothers avoid the stress and financial burden of formula feeding. Mental health is another area where breastfeeding provides crucial support. New mothers often struggle with postpartum depression, anxiety, stress, and emotional exhaustion. Breastfeeding helps reduce these risks by stimulating hormones like oxytocin, which promote relaxation and emotional bonding between mother and baby. This creates a positive cycle that benefits both mental and physical health. In addition to reducing stress and depression, breastfeeding can improve sleep quality for mothers. Even though babies wake often, breastfeeding hormones help mothers relax more quickly and return to sleep faster. This improves overall rest, which is essential for recovery after childbirth and for maintaining long-term mental health. Breastfeeding also strengthens the immune system of mothers. While it is widely known that breast milk protects babies from infections, mothers benefit as well. Women who breastfeed have a lower risk of infections such as urinary tract infections, mastitis, and other inflammatory conditions. By supporting the immune system, breastfeeding helps mothers stay healthier and stronger. Another advantage is that breastfeeding helps regulate the menstrual cycle and delays the return of periods after childbirth. This natural spacing between pregnancies not only helps mothers recover, but also reduces exposure to hormones linked to reproductive cancers. It is a natural and healthy benefit that supports overall reproductive health. For women with a family history of chronic illnesses, breastfeeding provides additional protection. If a mother has a genetic predisposition to diabetes, heart disease, or cancer, breastfeeding can significantly lower her risk. Mothers experience a long-lasting protective effect. In addition to its cancer-preventing properties, breastfeeding plays a vital role in supporting health. Mothers who breastfeed are less likely to develop heart disease, diabetes, and high cholesterol. This is partly due to the breastfeeding patience every day. In the end, I know the reason for why I cannot just you. You're joking on your words. Don't act like you're concerned. You know what you have done, so don't act like you're a victim. This also lowers the risk of obesity, which is a major contributing factor to heart disease, diabetes, and other chronic health conditions. Breastfeeding also supports bone health. Mothers who breastfeed have a lower chance of developing This is because breastfeeding improves calcium absorption and helps keep bone strong, even as the baby ages. The protective effect continues for years, making it one of the long-term benefits. Far away, you're so far away. Far away from reality. Far away, you're so far away. Far away from reality. You know that I cannot go back to where we had. You know that you're not wise, not going back in time. While most people know about the nutritional value of breast milk for infants, fewer realize the significant health advantages it brings to mothers. Beyond being a source of nourishment for the child, breastfeeding acts as a natural safeguard for women, lowering the risks of many life-threatening illnesses and supporting long-term health. Exit damage is not just about someone's health or well-being. One of the most remarkable benefits of breastfeeding for mothers is its role in reducing the risk of various cancers. Studies have shown that breastfeeding lowers the chances of developing breast cancer, ovarian cancer, uterine cancer, and cervical cancer. This happens because breastfeeding helps regulate hormone levels, particularly estrogen, which is linked to cancer cell growth. By reducing exposure to these hormones, mothers experience a long-lasting protective effect. In addition to its cancer-preventing properties, breastfeeding plays a vital role in supporting heart health. Mothers who breastfeed are less likely to develop high blood pressure, heart disease, diabetes, and high cholesterol. This is partly due to the way breastfeeding burns calories and restores the body's natural balance after pregnancy. These benefits make breastfeeding a natural shield against some of the world's most common and dangerous diseases. Weight management is another area where breastfeeding helps mothers significantly. Many women find it difficult to lose pregnancy weight, but breastfeeding naturally burns extra calories, helping mothers return to their pre-pregnancy weight more easily. Breastfeeding is one of the most natural acts of human care, yet it remains one of the least understood and appreciated in its full depth. Often seen as just a method of feeding a baby, breastfeeding is far more than a nutritional process. It is a powerful biological, emotional, and social experience that offers a wide range of benefits to both the infant and the mother. From the first drops of colostrum to the last moments of weaning, breastfeeding provides unmatched support for growth, development, and bonding. The early milk produced by a mother's body after birth is called colostrum. This thick, yellowish fluid is rich in antibodies and acts as the baby's first immunization. It provides protection against infections and prepares the baby's digestive system to handle life outside the womb. Colostrum contains high concentrations of immunoglobulin A, IgA, white blood cells, and growth factors, giving the baby a strong immune foundation during the most vulnerable days of life. Breast milk is a dynamic, living substance that changes in composition over time to meet the baby's unique and changing needs. It provides the exact amount of proteins, fats, carbohydrates, vitamins, and minerals required at every stage of infancy. Unlike formula, which is static and manufactured, breast milk is tailored to support a child's development.